My name is Lofaro. I'm a 7th semester nursing student. It's February 19th, 2021 at 9:30 a.m. and I will be demonstrating trach suctioning and total trach care on my patient today. Before I entered the room, I would want to check for a position order, and then I'd want to indicate whether my patient needed suctioning or not by listening to her respiratories, seeing if she has any increased secretions, if she's coughing a lot or having trouble breathing. Also want to give her a listen and look at her O2 stats as well. Then I'd gather all my supplies and then go ahead and head into the room. Hi, Mrs. Smith. My name is Bailey, and I'll be your nurse today. We're going to be suctioning your trach, and then we're going to be cleaning it and changing it, okay? And if my patient wasn't able to talk and she had family in the room or something, I would have them verify her name and date of birth. And then I'd want to go ahead and establish an effective form of communication with her. Mrs. Smith, while I'm suctioning you, you might feel a little bit of pain or feel like you need a break or something. So if any of that happens, you can go ahead and just raise one of your hands and we'll give you a break, okay? Okay. So I'm gonna raise her up to my height. I'd make sure to provide privacy, everything like that. Okay. Just a clean glove. I'd want to turn my oxygen up to hyperoxygenate her, and then I'd want to go ahead and turn my suction on, continuous, and then I would just check it, making sure that it's stopping between 80 and 120. Awesome. Okay. So after I've done that, I'm going to go ahead and put this towel on her. This will just catch any of those secretions in case they were to fall out. All right, Miss Smith, I'm going to put this towel right under you, okay? Okay. Do hand hygiene. Okay. Open my kit. Okay. I'm just going to take out this little basin part. And since this normal saline has already been used, I would rotate it and get that top film off of it. Then I would go ahead and dump it in. Okay, now I need to put on my sterile gloves before I do anything else. So I would do hand hygiene again. Oh. Before I put on my sterile gloves, I'm gonna actually go ahead and open the kit so I don't break sterility after I have my gloves on. Okay, now I can put on my sterile gloves. Making to stay in that 1-inch border. Okay. Okay, now that I'm sterile, I'll move back over here. And I can go ahead and get my catheter out of my kit. Okay. All right, so I'm gonna come over here. I'm gonna break sterility with my non-dominant hand. Up. Okay. I just gain control of it. And I'm going to work first by flushing the line. Okay. With my non-sterile hand again, I'm going to remove her oxygen. All right, Mrs. Smith, we're going to go ahead and suction you, okay? Like I said, if you need a break or you're having any pain, just go ahead and raise a hand for me, all right? Okay. All right, so I'm gonna go until I meet resistance. Okay, and I'm gonna do continuous. Making sure I have control. Putting that suction back on. I'm gonna give her like 30 seconds to a minute to recover, kind of let her cough and get that oxygen back up, and I'll go ahead and flush the line again. All right, Mrs. Smith, we're gonna do another pass, okay? All right, so with my non-sterile hand again, I'll remove the suctioning. All right, Mrs. Smith. Again, just going until I meet resistance, writing continuous. Okay. That oxygen back on. Okay, so now I'm done. I can break sterility and go ahead and remove this. Suctioning right here. We're also going to remove this little V-sponge, the sturdy one, since we'll be changing it. Then we can just wrap this all up into our gloves. Okay, so now I'm going to go ahead and clean up. Do hand hygiene. All right, so I'm going to make sure I get my trach kit. And I'm going to go ahead and just open the top so it's ready for me after I have my sterile gloves on. Okay, then I can go ahead and put on my sterile gloves. So I do hand hygiene again. Okay, so now that I'm sterile, I can come over here. I'm gonna get my sterile field ready. Keeping it above my elbows. Okay, so now I can start adding stuff to the middle of it. Okay, so what I would do first, I'd go ahead and add the saline to all 3 compartments. So I would do that. And then I would take my hydrogen peroxide and just dump it into one, diluting it with that saline. And then make sure everything's set up for me like the way I want it. Okay, so I'm going to come over to my patient. I'm going to break sterility with my non-dominant hand, remove her oxygen, and take out the old trach. All right, Mrs. Smith, we're just going to go ahead and take this out, okay? Making sure to grab a hold of it. I'm going to put it into that compartment with the hydrogen peroxide in it. Giving it a second. Kind of sit there and clean. I'm going to take it out again with my non-dominant hand. And then I can grab my, with my sterile hand, I can grab my cleaning supplies and go ahead and clean it. So I'm going to clean it not over my sterile field, I'm going to clean it over my trash can. Making sure to just have a good hand on it. Making sure it's really clean. Okay, so I can go ahead and put it into the normal saline. Okay, so then I'd give it a second. Now with my clean hand, I can go ahead and take it back out. I'm going to tap off that excess fluid right there on the side on the inside. Bring it back over to my patient. Go ahead and insert that back in. Until I hear the click. Add the oxygen for a minute while I get my cleaning supplies. So again, just with this clean hand, making sure I'm staying clean with this one. I'm gonna remove this and we're gonna clean around the trach. Making sure to remove any of those secretions that I see. Also, if the trach were to become dislodged, I want to make sure that I had the same size trach in a size smaller, just in case. Cleaning that. Then I want to make sure that I dry it really well. Just getting under there and drying it. Place the oxygen can. Okay, so after I had cleaned everything, I would go ahead and I'm going to go ahead and change the trach ties before I replace her new V-sponge. So now that the sterile part's over, I've cleaned her and everything like that, we can break sterility with both hands to change the ties. All right, Mrs. Smith, I'm going to remove this and we're going to change those ties, okay? I'm gonna reach behind you, sorry. Have to reach in front of your face, sorry, Mrs. Smith. Making sure I get this new one on. Now I can go ahead and remove the old one. Just making sure I'm checking on her, making sure she's doing okay, doesn't need a break. Okay, so now I'm gonna check, make sure I can get 2 fingers under this one and make sure it's tight enough. Everything looks good. Put oxygen back on her. I dispose of the old trach tie. At this point, I would don new sterile gloves before I put the V-sponge on. So for video purposes, I'll just keep these ones on. But now I'm sterile again, and I will be replacing the V-sponge. All right. I'm gonna come over here. I'll just break sterility with this hand. Just gonna make sure I stay sterile around the trach, and then I can go in and fix it once that part is done. Okay. Okay, so now I can kind of, now that it's at least around the trach, I can work to kind of maneuver it. Okay, so once I had done everything, make sure I give that oxygen back to her. Make sure she's doing okay. I would probably take a listen to her and everything like that just to make sure everything went well. I would lower her back down, make sure she didn't need anything, get her call light. Once I finished this whole procedure, I would go and document everything that I did, the amount of suctions that I did, how she tolerated it, everything like that, and then make sure that the team knows and that I date and initialed when I changed the trach so that they would know when to change it next.